I'm Christie Block. I am a behavioral health clinician at BLUESLEEP, and I help people stop snoring with a behavioral therapy program. It is 10 sessions over 10 weeks, and I help people position their tongue differently in their mouth. When we snore, our tongue tends to bunch up in the back of our mouth, and it closes the space back there and creates the snoring sound. In the therapy program, people learn how to keep their mouth closed and position the front of their tongue just behind their teeth at the roof of their mouth. This helps the tongue stay away from the back of the mouth where the snoring sound is made. So how do we do this? There's a lot of counseling and practicing with tongue exercises. Practicing keeping the tongue in a certain position, and also doing exercises that help strengthen the tongue so that it can rest in that target spot without effort. We also talk about lifestyle changes. That includes using a nasal wash to keep the sinuses clean and changing your diet to make sure that reflux is not an issue, which is often common for people who snore. This program helps people who can breathe through their nose. You must be able to breathe through your nose in order for it to work.